The great things that we do over at Baylor is that we do a lot of studies. And who do we need the data from? Our community. I come in and I say, but what are we going to give the community for their feedback, for their time to complete surveys? Let's give them Amazon gift cards. So for this one right here, this is a current study that we have going on right now. It is a 12-week study. It is one video appointment. The patient does not need to go anywhere. The client, mommy, does not need to go anywhere. I'll send her a video link. She logs on for 20 minutes. We go over parenting info, but that's not the point. Afterwards, she's going to receive a link with a survey. For each survey that she completes, which is 3 of them, the first one she'll get $50. Second one, she'll get another $50, and the last one, which we do it intentionally like that, is $100. We need for her to get to the last one, okay, so we can collect all of our data. This is basically, we want to know, hey, have you heard a lot about breastfeeding throughout your entire pregnancy? And you're like, hey, y'all aren't talking enough about postpartum depression. Or these are the barriers that me and my family are currently coming across, and what are we doing to improve these systems? So how can we do that? By them providing that feedback. So that's what this is for. Why is the incentive so big? $200, we gotta admit that's pretty big. I do studies like this, and usually we'll do one $50 gift card, but this one is $200. Why? Because they must have an 11-week or younger in the home. She doesn't want to be on the phone with me. Definitely not, and especially if she's a first-time mommy, most definitely not. So that's the reason we inflated that incentive for those new mommies. And even, it's not only for I've spoken to mommies that have 5 children, 1 new mommies, anybody that has an 11-week or younger in their home, they're able to actually be a part of this throughout the state of Texas. So anywhere in the state of Texas, you can actually be a part of this. And if you have a huge population of women in this population, let me know, because I actually have a good bunch that you can take back with you. Okay? So now that I've explained to you everything that's on your table, let's start to rock and roll. Okay? We're going to start off with this right here. So I want you to think back at those families, those clients that you assist, whether it be on a daily, weekly basis. Think about that one family, whether they were juggling just everything that they're doing. They have 3 children, she goes to work or she goes to school, or mommy's at stay-at-home mom, but the child has autism and she has 3 other children. That's juggling a lot of things. Or let's say that they're engaged in multiple systems. Basically what that means, she goes to WIC and then she's going to Nurse Family Partnership. 2 different organizations across. So that it could be any organization as long as she's working with various organizations. If she's involved with CPS, or that they have fear of becoming involved with CPS. And the reason that I add that is because we've actually had a lot of mommies come through the family care portfolio that came out of the system. And they just they're amazing mothers, amazing, but they carry that fear. And we try to fight that fear, and we try to confirm, hey, you're on the right steps, you're doing everything. No, but I'm scared. Why? Childhood trauma. Okay? So, or also, if by any chance they're involved in family courts. And then also, I want you to keep your mind very broad. I'm not only talking about parents, I'm talking about caregivers as well. Let's say mommy and daddy are in treatment, or let's say mommy's in treatment and the children are with grandparents or with aunt. The family care portfolio could work with either the actual birth parents, biological parents, or caregivers or foster families, as long as there's a child in the system. Involved. There we go. And also, if by any chance they have a substance use disorder, or if by any chance that they have had a substance use disorder in the past. And then also, just basically, hey, we live in a 1-bedroom home with 5 people living in a chaotic situation. Or that they just need back that organizational skill implemented into their home, into their life. Sometimes life just happens. Trauma happens, we lose that organizational skill. And as adults, that's crucial That is crucial. That's what you're taught as an adolescent into adulthood. How to be organized, how to get everything in order. Well, sometimes through our ACEs, as many of y'all know, adverse childhood experiences, they lose that and they're always in the fight or flight mode, right? So this can also be a tool that could help people, families, caregivers, keep them organized and planning ahead of time, okay? So with those families in mind, if any of these families that you've worked with have either can fit in this category, or maybe I've even skipped some, but you say, hey, this family could possibly still benefit from a family care portfolio, I want you to keep those families in mind. So like I said, at the end of this, you're going to be fully trained for the family care portfolio. At the end of the day, everybody, very simple. We spiced it up, called it a portfolio. But as you can see on your table, it's a binder with 7 tabs. We're going back to elementary, or not even middle school. Yes, ma'am. Yes, ma'am. Let me get you one. So I'm going to explain to you why the family care portfolio was created. I'm also going to explain to you what exactly is in the family care portfolio, the purpose of a family care portfolio, and then we're going to end off with some family testimonials. And that's the last one I got. I come from Houston, Texas, y'all, so you got to forgive me if by any chance your table does not have a portfolio, but we'll go ahead and pass one out, but I do have one for y'all, okay? So now we're going to go ahead and jump in. At the beginning, I don't want to lose you, okay? Because I am going to go through federal legislation, all that good stuff, right? But I need to tell you this, because I need for you to understand why the family care portfolio was even created, okay? So hence the reason that I must go through this. So what is the family care portfolio? At the end of the day, it is a tool. A tool being the portfolio that's in front of you. It's to help pregnant individuals and families with small children. Whenever I say small, am I talking about a 3-year-old, a newborn, an 11-year-old, 15-year-old? The definition is up to you. It's actually up to the family, what they consider a small child. So in other words, there is no age limit for the family care portfolio. Who is the family care portfolio for? Pregnant individuals and families with young children who just need help juggling all of life's tasks. When was the family care portfolio developed? 2020, 2021. The family care was created, developed, and pilot tested it. But let me give you a little bit more of that. That doesn't justify what we did. I'm going to go on to another slide and explain to you what exactly we did on this pilot. Where was the family care portfolio tool developed? Each state was expected to create their own family care portfolio. So basically, federal legislation said, hey, each state, all 50 of y'all, need to do something about the substance use disorder within infants. What are y'all gonna do? So they left it to each state to create their project, their program, their grant. And rightfully they should, because who is the best person to how can another state create our programs here in Texas? So that was actually a pretty good move on their end. Now, why was it developed? To help families stay organized and to empower them to advocate for themselves as they work with multiple providers and to navigate through multiple systems. Okay, family care portfolio. Previously, it was known as the Plan of Safe Care. And that's actually, if you go up to California, that's what it's still called there, Plan of Safe Care. If you go to Connecticut, Plan of Safe Care. So let me explain to you what exactly happened. So on the slides, we get very technical, but I like to explain it a little bit more simplified. This is the way I learn, and I like to really explain it this way, because I think it puts it out there. California, mommy walks into a clinic and says, I think I'm pregnant. Okay, let's do a pregnancy test. But at that pregnancy test, what else are they gonna do? A urinary drug analysis. Standard. Mommy comes back positive, pregnant, but also positive for methamphetamines. California comes in and says, hey mom, so we're pregnant, but we're also positive for methamphetamines. What do we wanna do? What are your, do you wanna know some of your options? Yes, I actually wanna seek treatment, but I don't have insurance. I've been trying to get into treatment, but every treatment center that I go to, I don't feel that it's right for me. So let us help you by creating a plan of safe care, okay? Then, time of delivery, who's gonna show up? CPS. CPS is definitely going to show up, because at that initial visit where mommy came in saying, I think I'm pregnant, and we did a pregnancy test plus a urinary drug analysis, again, standard, it also got red flagged. She got red flagged, so at the time of delivery, most definitely CPS is going to be there. But guess what she has been doing from the time that she found out she was pregnant to the time of delivery? She has been creating a plan of safe care. She has sought treatment. She has gone to her parenting classes. She has been compliant in all her OB-GYN appointments. She's been able to keep track of all her urinary drug analysis that they're negative, 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 negative. So she shows this to the CPS caseworker. Okay, valid point. You're going to go be able to leave with your child, but we are going to still keep the case open and follow you a little bit more as support. Was the family care portfolio the reason, or the plan of safe care, the reason that she got to leave with her child? Most definitely not. This was just a tool. She's the reason that she got to leave with her child. She made the efforts. She went into her OB-GYN appointments. She went into parenting classes. She sought treatment, okay? Second example, mommy walks into a clinic in Brownsville, Texas. Hey, I think I'm pregnant. Okay, let's do a pregnancy test. What are we also gonna do? Standard, do a urinary drug analysis. Hey, mommy, you're pregnant. Never lets her know that she also came out positive for crack cocaine. Did we provide that mommy the opportunity to seek treatment? Did we give her her actual options that she has? Should she be aware of all the options she has? No, because sometimes these families come from the federal poverty levels, come from under the federal poverty level, so they think that there is no options. There is no way I can get insurance. There's no way I can afford this. They don't trust the system, some of them. So that being said, at this point, we're not providing that option to our women. So guess what happens? Time of delivery, who's going to show up? Who's going to be taken away? Because most probably, just going by statistics and studies, the mommy did not receive support. The mommy still kept on using, affected more the child. And at the end of the day, this is where it comes back for. Federal legislation said, hey, when the baby goes into NICU, that's costing us a lot of money now. Hey, these children are still being born with a substance use disorder. What are we going to do now? That's how I came into the picture. That's how Baylor came into the picture. Saying, okay, hey, remember those funds you were giving out for plan of safe care, family care portfolio? We want to take it. Texas wants to take it now. And that's what we're doing. I have specified substance use disorder. But let me tell you something. And this bad boy keeps on moving without me knowing, but I take it back, y'all. Awesome. Okay, so now, so we get a clear understanding of that? Awesome. So now let's say we said, hey, Texas wants federal legislation funds to tackle this issue. So Dr. Van Horn, Dr. Cummings, along with 2 other individuals, we're not a warehouse of people. We're 4 individuals trying to do this. So we came in and we said, okay, let's start it. Let's start it from the ground up, because again, each state was to create their own program from the bottom on up. Who's best to know our community but ourselves, right? So what we did a pilot study from June 2020 to May 2021. We did it at a substance use treatment center, a very unique substance use treatment center in the state of Texas that not a lot of people know of. And the reason that you might not know of it is because it is very secluded, and they do not give out their address, their phone number, because of domestic violence, because of violence that has come into the facility. So this treatment center here says, hey, mommy, you want to go into treatment? Okay, bring your kids as well. Let's all go into treatment. We're going to take your kids to school. You're going to go to classes while they go to classes. We got you. But usually treatment centers will separate everybody, right? Well, this one is very unique. It's called Santa Maria Hostel. They're a very unique substance use treatment for women with a substance use disorder with children. But children are actually allowed in this substance use residence. Now, that being said, though, in this organization, they also have another program that has women without a substance use disorder, but although are incarcerated and are doing their time there, right? So they still get to go to their classes. For some odd reason, they place that program there. So keep that in mind. So we did this with 200 women over 5 organizations. One of those leading organizations being Santa Maria Hostel, family courts, all those court cases that come in saying we're fighting for the children because there's a substance use disorder, there's whether it be with the grandparents, the aunts, father and mother. So we also got family court involved. We got also a healthcare system involved, which is Bentop Hospital. Bentop Hospital is, I believe, the nation's top 5, part of the top 5, best ER centers in the nation. So basically, if I would get shot in Houston, that's where I want to go. It's the #1 trauma center, and it's in our medical center. Child welfare, the foster care clinic, we also got them involved. And then, of course, also Santa Maria Hostel. So we got these 5 organizations, right, with these very unique patients, with these very unique professionals, right? And we said, okay, guys, this is what we want to do. You want to help us? They said, okay, let's do this. So we started our pilot study, right? So we talked to a group of women saying, hey, this is what we want to do. This is a change. Are you willing to help us out? We'll provide you a portfolio. You give us your take. Try it out for a month, a year, 6 months. Let's see what kind of feedback you could give us. And we'll give you a car seat. We'll give you a playpen. We'll give you this and that. Okay, fine, I'll do it. Alrighty, let's rock and roll. Now, 6 months down the road, those women that are incarcerated within Santa Maria started saying, hey, what are all those colorful binders? Some of the girls I've talked to have shown it to me. Can I have one? But I don't have a substance use disorder. Of course, we're not going to say, no, you can't have one. We said, you know what? Of course you can have one. And everything that is applied towards substance use disorder, what do? Just like every other document that's something that's not applied to us, we place an A, or we take out the document. So that's exactly what we did. We opened up that window and we said, you know what? Now everybody that wants to just create a family care portfolio can create one. There does not need to be a substance use disorder in the home to create one, although it is designed for families with a substance use disorder. That being said, we still have seen that it's very beneficial for families that do not have a substance use disorder. And let me throw in an example. At a domestic violence shelter, they use the family care portfolio. They use it as their escape plan. Mommy puts in here Social Security, birth certificates, emergency contacts, local shelters, local pantries, everything. If she feels she is in danger, she grabs her portfolio and gets out with her kids. That's the way they use it. Now, we actually have other facilities. Nurse Family Partnership is another one that does it. In the very last tab, they actually put in their curriculum. So every time that they see that client, the client must bring out their portfolio, right? So at the end of the day, the family care portfolio is a tool. We provide the foundation. Y'all, the organizations, say, hey, I want to give it to families with a substance use disorder, or no, I want to give it to families with only one child, or I want to give it to families with autistic children, whatever the case might be. It is your choice. We just provide the foundation being the portfolio and the documents that are included. And I'm going to go through all the documents that are included and let you know, because we couldn't just give it blank to you. We had to give something. We had to create the foundation. So that being said, from these 200 women, they did implement the family care portfolio, and I'm going to be ending with their quotes and what we actually came out as the results. Okay. So, again, and I can't stress this enough, because there's always a misconception of, oh, where can I go to this program? There really is, it's not a program, it's more of a tool. And then, so an organization will take it on, for instance, Nurse Family Partnership, the domestic violence shelter that I just mentioned, will take it on, and then they just run with it. And they say, okay, we're going to give it to these clients, we're going to introduce it at this time, so on and so forth. We provide the foundation being the portfolio, the documents. Andre, how much does that cost? Let me just get to it already. It's towards the end, but I get so excited and I have to tell y'all. This is all state funding, absolutely at no cost. We are able to provide these portfolios after this training absolutely at no cost. All you have to do is just go online, request them, I mail them out to you. So, but Andrea, you don't need anything. I do need something from y'all. But I'll let y'all know about that in a little while. Not something big, believe me. We're not going to make it difficult, because at the end of the day, our goal is to get to those families, to just improve the situations of these families. Of course.
Okay, I work for DSHS, and I work with children with health needs. And we go to families, we're asking for like medical information. We want the list of drugs, all the specialists they see. Our meeting was at the school. How did it go? A lot of my families some are very organized and some are not so organized. So something like that, I'm just thinking in my head right now, that'd be great for us, but we don't need all the extra information in there. So can this be customized for your agency for the particular need?
So the key on there, and I want everybody's feedback. And I appreciate the question. I love the question, actually. And I love the fact that your mind is already trying to, again, picture that population, because that's how we started. Some of these documents, so for instance, one of the organizations that took it on said, hey, we don't need to know about daycare. But the families did want to know about daycare. So sometimes we just leave it in there and we leave it up to the family's discretion to say, whatever you don't find useful, take it out. Because at the end, there's actual resources that I'm going to go through that really opens up your mind for them, saying they weren't aware of this, but maybe now that I present it and they have it, maybe they'll look it up, maybe they'll use it. So sometimes it's good to leave these additional resources, with the exception of the medical information. I get where you're coming and what you're saying now. So let's say those medical, that substance use disorder, right? That page, if that doesn't apply to the family, by all means, you can definitely take it out. So yes, but the resources is where my mind was going, because I really dig the resources and I'm going to go through them. So most definitely you can alter it to your organization and your population that you want to make the portfolio for. So yes. So another key thing, everybody, the family care portfolio, you introduce it, then they run with it. Whether you see them a one time, stop right there, never see you again, or if there's follow-ups, right? Because it is their portfolio. That's another thing I can't stress enough. We want you, the more that you place in your family care portfolio, the more strength it has. And I'm not only talking about family court, CPS, no, for ourselves as well. We all have those clients that are not too compliant or not too organized, right? And this is a way that you can kind of hold them accountable to that. Saying, hey, next time I want to make sure that you have in here X, X, and X, complete this document in here, and then you get to follow up on it. So that's another way that you can actually use it to assist you in what you're already doing, because the family care portfolio is not meant to be additional work. Because once you give it to them, I can assure you a lot of it is filled out by themselves. What is your support system? What are your goals? Your children's demographic information, your demographic information, medical information, medication you're currently taking. So this is all information that they can fill out. And actually, I have an organization that gives it as homework on their first appointment, saying, I'm going to introduce it to you. You're going to fill it out as much as you can. In 3 weeks, I'll see you again, and let me know what kind of questions you have. Okay? So it belongs to the family. It is theirs to keep. They run with it. They can do with it as they please. And then also, it will help them demonstrate and communicate their family strengths, needs, and not only that, but also, I'm so sorry, guys, their accomplishments. And right now, you're like, how? Believe me, I'm gonna go through each tab and I'm gonna explain to you how exactly it demonstrates their strengths, needs, and accomplishments, okay? Of course. Actually, let me get at that too. I myself, as a Spanish-speaking individual and being a community health worker instructor out in the community for over 10 years, the one thing that I would come across is in my Latin community, saying I would give them, or somebody would give them a document in English saying, hey, give this to your pediatrician, okay? Make sure you give it to the pediatrician. And then I would call the pediatrician, no, the document never got there. And then I would ask the patient, Andre, I'm not gonna give it to him, I can't even read it. So, to answer your question, we do have a bilingual version, which is led in Spanish, but underneath it, it's right in English. So whatever the provider reads, the client reads. So there's no speculation for, what does this say? Hey, you could read it right in English, and hey, provider, you could read it as well.
So are we able to order a combo with some that are all English and then some that are...
Most definitely. Most definitely. So, and that, I'm not gonna lie, we usually see flyers that way, right? You turn them around, they're Spanish, and one side they're English. But I have not really seen a document like this that is dual languages, where it's run in Spanish, but underneath it, literally everything's in English. So to answer your question, most definitely, ma'am, it does come in Spanish. The goal of the family care portfolio at the end of the day is to strengthen the family, promote healthy pregnancies, and keep children safely at home. And I know a lot of you already know this. Sometimes chaotic home, but we take away the child and put them in foster care. There's still studies that show that they would still be more successful if they would have stayed in that chaotic situation. Isn't that mind-blowing? Isn't that mind-blowing? So, that being said, let's make their home a safe space already. Because that's already their safe space, what they consider safe, but let's make it truly safe for them. So, family care portfolio. Care. The family care portfolio should coordinate, advocate, record everything that they're doing with an ending result of empowering the family. So the care isn't just there because it's a nice word. No, it actually stands for coordinate, advocate, record, and empower. So, and that literally was a gift because we were like, wow, that's definitely the family care portfolio. Okay, who is the family care portfolio for? Again, let's get rid of substance use disorder. I had to tell you why it came into the picture, where the funding came from, but let's get it out of our heads already, because the family care portfolio could be for anybody, okay? Anybody that has young children at home that need extra support. This could include families that are experiencing domestic violence, substance use disorder, domestic incarceration, homelessness. We actually have it at Star of Hope, which is a homeless shelter over in Houston. We have it there, and they are able to keep track of everything that they're doing. And as you can see in the portfolio, they're not only tabs, they're pocket folders. So every document they just put in there, make it stronger and stronger and stronger. Because to us, an after visit summary. Do we all know what an after visit summary is? We go to the doctor, and then before we leave, they give us an after visit summary. This is everything that happened today. To me, God knows where they're at. But for a mommy that has been uncompliant in her pediatrician visits with their child, this after visit is crucial. Why? It could prove that she went. It confirms that she actually took her child. So whether, and again, let's take away family courts, let's take away CPS, let's say just for you, right? That you want to confirm, hey, did you go to your appointment? Do you have your after visit summary? Can I see it? Of course, with permission. You know, this is also something that can help us in confirming and keeping up with everything that they're doing while they're not in your care. So, families working with multiple providers such as case managers, doctors, coaches, recovery coaches, parent coaches, counselors, community health workers, case managers, social workers, the list can go on. I've actually reached out also to faith leaders because I've seen that a lot of our community actually runs first to the church that they do to the hospital, right? So I got a hold of my faith leader saying, hey, again, do you want this to be an option at your church? For some families that you feel just need that extra help, that come to you, that need guidance. Do you want to provide this to them? Okay, yeah, let's do this. Alrighty, let's get everybody trained. So that's what we've actually done as well. So as you can tell, by this right here, what I've gone through so far, broad, right? Who can the family care portfolio be presented to? Any family with a small child that just needs guidance, needs an organizational tool. Who can present it? At this point, anybody, as long as you're trained, right? And then also, which organizations can provide it? We have it, I've already provided some examples. We have it with some of our faith leaders, domestic violence shelters, homeless shelters, treatment centers, the list can go on. Nurse-family partnership. So, that being said, When should the family care portfolio be introduced? And I also don't want this to be a misconception. So Andrea, if I missed them because they're pregnant, I can't give it anymore. No, most definitely, you could still give it. As early as possible, because our point...
Recording in progress.
Oh, okay. That was you, my friend, right? That scared me. I was like, oh my God, run everybody, there's a fire. Fuego, fuego. Okay, everybody. As early as possible, because keep in mind the example that I gave you about California and Texas, right? What we're trying to prevent is that child not being taken away from the family, giving the mother the opportunity, right? But let's say, like we all have seen it, mommy doesn't show up for her prenatal care till time of delivery, right? We've all seen it. So can I still provide it at that time? Most definitely. Let's say the child is 5 and just got into the state of Texas. By all means, go right ahead. So at the end of the day, if you believe a family can benefit from it, just initiate it. Plain and simple.
Recording stopped.
Okay, so that is the background on family care portfolio, what used to be known as Plan of Safe Care. Why did y'all change the name, Andrea? Because CPS actually has something that's very similar called Plan of something. So a lot of people automatically, when we would introduce it, they would be like, no, I don't want that, I don't want that. So we had to change up that name because it was getting confused with what's provided by CPS. And also, but we also like to end it with formerly known as Plan of Safe Care, because in other states, that's what it's still called. Us here in the state of Texas, we changed things up the way we do with everything, right? And we said, formerly known Plan of Safe Care, but it's family care portfolio, just so there isn't that misconception. So, any questions in reference to the background, the population, the organizations, all that great stuff? All the cities of Texas. At this time, we...
For me, from El Paso, Texas, okay, I'm from El Paso, Texas, it's for me something like you explained to me something new, or probably I'm too new on this system of care.
Mm-mm.
But that's the reason I was so like, where can I find all this? And when you said that, I was, it's a wonderful thing.
We
Especially
started-
because we got, this population, this real Mexican, Hispanics, and they really worry about everything, but at the same time, they don't want to confront the truth and be, it's real hard to help them, okay? Because it's some topics that they don't talk about it.
Exactly.
Oh, that's the reason.
No, great question. So we started our pilot where? In Houston. But slowly, this is a state initiative. So once we saw, hey, in Houston, it worked. And we're able to provide the data. And then the state said, okay, green light, go everywhere now. So right now we're actually in Del Rio, down in the Rio Grande Valley, San Antonio, Dallas, and a lot of those small little cities like Alice, Texas, where the substance use disorder rates are ridiculous, right? Those little counties. So this is statewide. Anybody can actually have a family care portfolio. Anybody could request one. So let's see, you said something else also. Oh yes, please do not feel guilty for not knowing about the Plan of Safe Care, family care portfolio, because why? Because we just started it. We just started it. We had to do our first year of study, which is the 2020, 2021, we're 2023 now. So for the first year, nobody should have known about it because we were just saying like, hey, let's just see if it works. Because if it doesn't, don't tell anybody, right? Right? And then we saw it worked and we were like, okay, phase 2, phase 3. Now we're at that phase that, okay, we got some good data. We show that it works. Now let's rock and roll. So now we're gonna get to the fun part. All those slides prior, like I said, I didn't want to lose y'all. Hopefully I didn't, but now we're going to get into the fun part. And the reason that I say that is because I'm able to share here one of the great things that I had the opportunity to do. Remember those 200 women? Okay, I had to go to them and to their homes, to laundromats, nail salons, wherever they wanted to meet, and say, okay, give me that feedback. Let's talk about it. What do you like? What don't you like? So as I'm going to be going through each tab, I love letting y'all know the feedback that I received from families with lived experiences, plus those 5 organizations, remember? The Bentop Hospital, the family courts, all those. They also came back and said, this isn't gonna work, ma'am. You need to change this up. So as I'm gonna be going through the portfolio, I'm gonna let you know some of the feedback that we got, because at the beginning, it wasn't even a portfolio, it was 3 pages. It was 3 pages. And then from all the feedback, this is what came out. In some states, plan of safe care is not even the family doesn't even see it. Sometimes it's just in the medical record and it belongs to the provider. But here in the state of Texas, we decided to make it client-driven, not provider-driven. So we want them to own it, them to take responsibility over it, them to care for it. So that being said, again, very simple. We spiced it up. We called it portfolio, but at the end of the day, it's a binder with 7 tabs, right? The first one is going to be our family health and support. Don't let me lose you on tab number 1, because it is the meat. Remember those 3 pages that we started off with? Okay, that's what we're going to find in tab number 1, right? Tab number 2, from here on out, easy peasy. Contacts. 3, consents and release of information forms. 4, resources, and I'm going to explain to you the foundation of resources that we put in there. And if you say, hey, my family doesn't need this, hey, let's go ahead and take it out. Or if you can introduce it to the family, and if they decide, I don't need this, they can take it out. Appointments and after visit summaries, again, keep in mind, for some of these families, it is crucial. Those documents are very important for them to provide over to family courts, to CPS, to their case managers, social managers. This could actually make a difference. 6, accomplishments, and 7, ending with notes and additional information. Remember that I told y'all that Nurse-Family Partnership uses this? Well, they put their curriculum in tab number 7. So they got rid of notes and they said, this is gonna be NFP. So that's where they put their curriculum. So they use it as part of their visit as well. Because again, we just provide the foundation, y'all run with it. Okay, it was perfect timing. Okay, the family care portfolio. As soon as you open it up, you're gonna see an update log. Because again, imagine those families working across different systems. WIC, a clinic, an OB clinic, a pediatrician, XXX, right? This is gonna be different providers. It is very important that you empower your client to say, hey, the more providers that you introduce your family care portfolio to, the more strength it has. Because the provider can actually come in here and write in it, keep track of everything that they're doing over at their end. And I'm gonna explain to you how and where and all that great stuff. So this is an update log. Let's say a patient comes up to you, you go, patient, can I see your family care portfolio? Do you give me permission? Family says yes. You open it, oh, I see that you went to the pediatrician and they made a change to the family support system. Let's see what kind of changes they did. So that's a way that all of us organizations could come together. Plus, how many times have 5 organizations been working on the same car seat? That happens a lot, right? Family goes to 5 different organizations and each one tells them, I need a car seat, I need a car seat, I need a car seat, which they do, right? And it's important, they need it. So they reached out to the most help that they could. So we have 5 professionals working on the same need. So the family care portfolio can actually help you to see if by any chance another organization is already working on this, and I'm gonna let you know how. So for instance, family says, I need a car seat. Oh, actually show that you already spoke to WIC about this. Yes, they're actually, when was the last time you spoke to them? Yesterday. Okay, give them about a week. And then if they don't come back to you, let me know. What's something else that you're needing assistance with? What's another barrier? So let's move on over to the other barrier, right? Which that makes a lot of sense. Okay, don't let me lose you. Tab 1 gets kind of tricky. So tab number 1 is the meat of the family care portfolio. This is where all of us professionals can come together. And also, I've seen some organizations use this as homework. Some of these families really like that homework. They feel like, okay, I'm getting back into something. I'm getting my power back into something. I'm writing, I'm keeping up with stuff, right? So the first one is parental demographics. Again, caregiver 1, caregiver 2, it says on there. It doesn't say mom, dad. It doesn't say bio mom, bio dad. No, it says caregiver 1, caregiver 2. Because again, the family care portfolio could be to grandparents, anybody, any family with small children. Does not necessarily need to be the biological parents. Parental medical history. If by any chance, mommy and belly, hey, how many, what's your estimated due date? How many appointments did you go to? Your ultrasounds, all that good stuff. Child information. Whenever we first started the family care portfolio, we were only thinking about baby and belly or baby that was born. But a family very quick said, hey, but I got 3 more at home. What about them? I said, okay. So we added a total of 7 extra sheets for additional children. And let's say, but Andrea, they have 10. Once you're trained, you have access to all these documents, so you can easily go in there and just print them out. Okay? At the very beginning. The update log is going to be the first document you see.
Oh, cool.
Of course, ma'am. And the child information will also have, again, this is not supposed to be added to your work. This is supposed to be just of what you're already doing. You're already collecting demographics. You're already collecting what school does the child go to, right? All the family is going to do is write it in there. Keep track of everything. What current medications that the child is on, what school, is there any learning disabilities, is there any CPS involvement, all that great stuff. Family and support system. We want to know who is your support system, right? Not only that, but the family care portfolio was originally designed for who? Families with substance use disorder, right? So we got to hit those spots right there, right? Because that's our funding. But again, if it does not apply to a family, all we're going to do is put NA, because I can assure you, I have some families with a substance use disorder that there's still some spots on here that does not apply to them. So whatever family it might be, there's still going to be spots that some of these sections might not apply to them. That being said, we ask on here, do you know how to access naloxone? I have a hard time saying it. Naloxone. Does everybody know what that is? No? No? Okay. Let's say somebody has an overdose, an opioid overdose. It's actually an injection that goes in, automatically brings them back to life. Narcan, there you go. Narcan, what did I say?
Naloxone is what they give heroin addicts, so where it fights the opioids.
Yes, okay, got it mixed up, sorry. Okay, Narcan.
This Narcan is also dose for
Yes. So we actually ask on there, hey, do you know how to access it? And even if you know how to access it, do you know how to use it? Because sometimes we can provide all the material, all the resources, but if they don't know how to use it, what's the point, right? So on here we also ask, if in the case that something happens, whether it be a domestic violence, understanding that recovery is a process, is a journey, and if in the case that there is a relapse, not that we're wishing it, but let's plan ahead. Who should your children go to? Let's plan ahead. This will reduce stress. This will get something already in the books for the children. So that is actually hit on tab number 1. And again, we can refer this one question in many different ways. The one way that I used it right now, domestic violence, right? Homelessness. If by any chance you, mommy, you, grandma, go homeless, where would you like your children to go to? Okay, so that question right there, which is in tab number 1, they're called safe caregivers. Who are your safe caregivers? And we explain what that is, and we also explain it should be somebody that has patience with your child, all those key things, right? So, and then we also have on here referrals and service sheet. Okay, remember the way I told you all, 1 car seat, 5 organizations? This can actually, and you know what? Let's all get our binders right now. Yes. So let me see it really quick if you don't mind. So this is going to be what it looks like, everybody. We've gone ahead and said, okay, let's see, food. Do you know your local pantries? Do you need SNAP? Do you need this? Do you need that? And it could actually be discussed, needed, referred, participating, completed, NA, that they don't need it. Okay, so that being said, this is the way that you can see if another company, another organization is currently working on already getting, for instance, prenatal health care. Okay, be like, oh, I show that you're already getting your Medicaid application done with your multi-service center. Okay, and this is a great way, not only that, but this is a roadmap also that I've seen it being used with a lot of case managers, that they're like, okay, This is that family that needs everything. But how do I start? You know what? Let's go down this list. Let's go down this list. Because sometimes we do have those families that we have to start from the bottom on up and go through everything. This is y'all's, right? Where did I get this one? Okay, and then the planning tool is, again, our safe caregivers. If in the case of a relapse, if in the case of XXX, where are my children going to go to? So that is going to be our tab number 1, okay? Now, that being said, Andrea, that's a lot. It is, right? But again, remember the way I said, the more providers that the family introduces it, the more power it gets. Okay, Andrea, but how are they supposed to know who to introduce the family care portfolio to? For instance, right here, prenatal care, complete with OB-GYN. And for the bilingual one, this is a perfect example, but it should actually be vice versa. So it's Spanish in front and the English in the bottom. So in each section, we actually notate who's the best person, who's the best professional to help the family complete that with. If by any chance it's medically driven, CPS driven, whatever the case might be. We actually put on there, refer over to case manager, social worker, XXX. So it gears the family on, okay, I need to talk about this part with my OB-GYN or with my social worker. Okay, and of course, in the referrals and services, we might have missed a couple, right? Because of course, we try to think about all of them. But if in the case that there's one, for instance, right here, support services, this family needed marriage counseling. It's not listed on here, but in each section we put other for you to write in there what exactly. So they were referred over to marriage counseling, referred to Brighter Org. Her name's Kim Sanchez, and that's the phone number. So that's an example there how that document could be used. Okay, any questions on tab number 1? No? Okay, so from here on out, it's easy peasy. It's gonna be our standard stuff. And let's start off with our contacts. It starts off with an emergency contact list. If by any chance the mommy needs to go to work, needs to go to school, needs to step out of the home, she leaves the children with somebody else, this is an emergency contact right here on the local emergency room, the pediatrician information. Are my children allergic to anything? Emergency contacts. She can either leave it, they can either leave it in the portfolio or they can take it out and put it on the fridge or in their closet. It is up to them because at the end of the day, it is their portfolio. Second document is going to be our contact list. Everybody that they're currently working with. Let's say that you want a quick snap. Who else are you working with? Here's my contact list. This is everybody I'm currently working with. So, and if by any chance, once you turn around that document, it has other, because we know we probably missed some professionals, right? But you can actually write it in as well. And the next document is actually going to be one that was feedback from one of our clients, and she had her own. She would say, and this was a client from Santa Maria, she says, Andrea, I call my CPS caseworker like 3 times a day. Her voicemail's already full, and I think it's full for me. And I've also sent her a text. So I keep track of it, Andrea. I keep track of everything, because what if in the case that like she doesn't believe me? And I can give her like, hey, I called you X, and can you add something like that on here? Most definitely we did. We call it our communication log. So every time that the client, the family makes an outbound attempt, whether it be by phone, by text, by mail, by email, whatever the case might be, in person, whatever the case might be, they get to keep track of it and if a follow-up is needed. So this is a great way for you to also keep track of what attempts are they trying to do? Who are they trying to get a hold of? And it's a great way for them to keep track of all the efforts that they are doing in the case that they're needing to prove it to somebody. Because a lot of these families, I hate to say this, but sometimes that proof is crucial. And those business cards that we love to give out left and right, well, we went ahead and threw in a business card holder as well. So let me tell you a way that I saw an organization use this, which I thought it was just genius and built rapport really awesome. So first, the individual was very closed off. Rightfully, she had been through domestic violence. She had been on meth for about 5 years already. 2 children have already been taken away. 3rd one's on the way. Very closed off, right? I don't even, a trauma-informed care, 110%, this is our approach. So, and then as she walks off, we introduce the portfolio to her. She walks off and her social worker goes, if you need me by any chance, my contact information is already in your portfolio. My business card's in there. You could call me, email me, do whatever you need, but my info's already in there. So that right there, I heard it and I said, it helped her build rapport. That right there helped her build rapport with that client. Like, hey, I got you. Let me let you know that I already did this right before I even met you. You have my contact info. So I thought that was a genius move on how to build rapport with a client that's very, very closed off. So that's going to be our tab number 2, our contacts information. Tab number 3 is our consents and release of information. This tab is not a consent. It's a way to keep track of all of our consents. Every time we go to the doctor and we sign these consent forms, they give us a copy, right? Would you like a copy of it? And right? So this is a great way for that family to keep track of everywhere that they've signed a consent form. Yes, I would like a copy of it, and keep it in their pocket folder in their portfolio. And they're also able to keep a log. But we didn't stop there. We said, automatically these women said, why do we need to sign those forms, Andrea, Beth? Why do we need to sign them? Hey, let's do an FAQs. Let's take this opportunity to educate them. Why is one needed? What rights are you giving? Can you say no? So we started it off with a frequently asked questions for consents and release of information to go ahead and educate the family about their rights, and not only that, but the benefits of signing one. Keeps on moving, y'all. So again, it starts off with the frequently asked questions. It's a log to keep track of everywhere that they've signed one, and it's also a way for them to store the copies that they've signed. Resources, this is my favorite tab, y'all. So we couldn't give it blank, and of course we had to go to resources, right? Some of these resources may not fit your family, and that's okay. They can just take it out, but we wanted to not give it just blank. So again, the more providers that the family introduces their family care portfolio to, the more strength it has, right? Because the more people come into it, the more people write into it, the more power it has. So we went ahead, family care portfolio is fairly new to the state of Texas. So first, talking about any barrier is already hard. Talking about domestic violence, homelessness, substance use disorder, or just the fact that, hey, I am horrible at organizing. That itself is hard, right, to tell somebody. So what we did, we started off in this tab with a script. How to start that conversation with a professional. Like, hey, professional, so I'm currently going through X. This is what I've decided to do, a family care portfolio. I'm asking you to please partake in it. This is what you would be responsible for. This is what my goal is. So we've started a script for them to introduce their family care portfolio, because it's hard to start those conversations. And just the way we made a script for the client, we made a script for professionals. How you can introduce it to a client in your provider toolkit, which you'll have access to online afterwards. So not only that, but also goal planning tools. We're gonna have 4 of them. And these have actually been used by a couple of the organizations that are doing it. They'll start off, we want to build that rapport with clients. And what are your goals? Well, how about we write them down and keep track of them and actually keep on working towards them. So this has actually been implemented at some of the facilities as part of the curriculum. Now these 3 next ones, I'm super proud of, guys. Choosing a prenatal care provider. Again, family care portfolio, care, coordinate, advocate, record, and empower, right? Empower. So these next 3 documents are not only like, hey, this is what you should do. No, you get to turn it around, and it's an actual questionnaire for you to take with you when you talk to your OB-GYN, when you go look for a daycare, when you go look for a pediatrician. Hey, pediatrician, how do you feel about pacifiers? Because if you don't agree with your pediatrician, is she going to be compliant to go to her appointments? No. So you want to make sure, you want to empower them to, hey, you want to make sure that you question them about what is their take on your beliefs? What is your parenting style? Not only that, but the one that I'm super proud of is going to be the child care. Some of our families said, so on the choosing a child care, at the very bottom, there's a QR code where you can go in into, it's a state website, and you can see if that daycare has received any violations, right? So whenever we introduce this to families, they're like, oh, we thought only y'all had access to that. And I'm like, first, who's y'all? And secondly, no, this is state information. So the family always educating them, hey, before you even choose them, have you made sure that they haven't received any violations? Have you verified that they're certified? Not only that, but if you turn around that document, imagine a mommy going in, you empowering her saying, hey, when you go in, take in your document so you know what to ask. Simple questions and simple observation. Do the employees seem happy? Do the kids look happy? How often do you clean your toys? How many teachers, what's the ratio of kids and teachers? These type of questions, right? Now imagine that actual scenario in your mind. Does that family, does that individual look organized? Are you gonna question her ability as a parent? No, you're gonna be like, okay, I see you. You're onto something. And I'm gonna come right with you and I'm gonna answer you and make sure you feel safe and comfortable, because if you're a good professional, that's what we should rightfully be doing. Choosing an OB-GYN. Whenever in this document here, choosing prenatal care provider, I'm sorry. So on here, on this one here, again, all three of them are gonna be questionnaires. You turn them around, hey, how do you feel about C-sections? How do you feel about breastfeeding? Not only that, but with the pediatrician, sometimes you can go to school to be a pediatrician, but you also have like a specialty, right? Like, hey, do you have a specialty under your belt? You know, another degree, XXX. So, but on the choosing prenatal care provider, so a lot of our families did not know the difference between an NP, an OB-GYN, a midwife, a doula, all that great stuff, right? They're like, oh, that's what they do. So on there, we put a list of each one. So they can choose, say, like, oh, I really like the description of a doula or of a midwife. Let me try to see if my insurance covers one. And nowadays, which I'm super, super happy about, Medicaid covers actually like doulas, midwife, even water births now, birth centers. So our women are starting to have the same opportunities as everybody else, which is super awesome. And especially with the new Medicaid expansion, which is super awesome, that now the women get to actually have insurance for a full year after birth, opposed to the 3-6 months that they were usually getting. So what was happening there? There was no birth spacing, because they would fall in the cracks and no longer be on birth control. And then another child would come into the picture. No birth spacing. And the importance about birth spacing is for the mother, for her mental health, for her physical health. So that being said, that is our resource tab. But let me tell you, if you're, for instance, the homeless shelter that has the family care portfolio, in here, they know their population. So they put in there the local shelters. They put in there their local walk-in and receive food on a daily. So they already know the population, so they already put in their resources in there, right? The domestic violence centers, they'll put in their tips and tricks and what to look out for, and their hotlines and all this extra resources that their population needs, right? So you can add on to this tab here as much as you would like, what you feel is needed by your family, but we definitely did not want to give it blank. So we started off with these documents here. Next one, appointments and after visit summaries, just what it's called. It's a way for the family to keep track of all the appointments that are coming up, not only for the children, but also for the family as a whole. Not only that, but also one of the families actually told us, Andrea, I don't need to know February the 23rd. I just need to know if it's a Wednesday, because that's the only day that my husband is able to take me to the doctor. So I can only get appointments on Wednesdays. Does that fall on a Wednesday? Why don't you just add a calendar, Andrea? And I'm like, this is genius. Why didn't I think of this, right? So simple. I felt not very smart. So we added the calendar. But again, this tab here is crucial. Why? Those after visit summaries, right? We had a family that was receiving services from a county clinic. The whole time to even get a hold of them was possibly an hour and a half, right? And the phone number would go directly to a call center, not to the clinic. We all know those systems, right? She's like, Andrea, they changed his milligrams of medication, I don't know how much, and he had epilepsy, right? So she's freaking out. First time mommy, 19. First time mommy, 19. She's freaking out. Andrea, I think it was 10. I don't know, but it went from 5. I don't know, Andrea. And I keep on calling and calling and nobody answers. Nobody answers. I've left. And I go to your after visit summary. It should be on there from the last visit. And sure enough, it was. It showed the summary of what was the dosage change. What happened in that situation there automatically decreased the stress of mom, automatically resolved the issue. Not only that, but it gave her a purpose for her portfolio again. Okay, you know what? It's actually important that I keep these after visit summaries and keep everything organized. They can actually become beneficial. So the after visit summaries can be used in this instance. For me personally, whenever we first did our pilot, my quick thought from working with family courts was like, this is a way for them to confirm that they've been compliant. But this family completely opened my mind to a different way of seeing this tab here. Accomplishments, my second favorite. Okay, so this tab right here was first called Certificates and Accomplishments, right? And I saw parenting certificates, breastfeeding certificates. That was me, right? I was like, oh, so pretty, right? But a client very quickly put me in my place. She was at Santa Maria Hostel, the treatment center. I went to do her feedback, and I asked her for permission to get her portfolio. She says yes, and I go to accomplishments. I get to accomplishments finally, and there's all these drawings. And my thought process was like, this child is playing with my portfolio. She's drawing all over it. OMG, but don't let it come out of my face. Trauma-informed care always. Trauma-informed approach. And I go, okay, let me know. What's going on here? Let's call her Sarah. Hey, Sarah, what's going on here? Let me know about this. She goes, Andrea, whenever I was in high school, I wasn't known for being smart. I wasn't known for being good at sports. I was known for drawing. And she was Latin, and she would draw all these Aztec. She goes, I would draw all these Aztec on handkerchiefs. And people would pay her $1 here. She was like born in the 90s. I mean, she was in high school in the 90s. She's like $1 here, $1 there. She's like, and people would like come up to me, and I was like, man, I'm good, right? I'm good at this. Then opioids came into a picture, right? She lost her vision, not actual vision, but vision in life. She lost all her goals. She dropped out of high school, became a heavy, heavy, heavy user. She placed herself in very dangerous situations. 5 years down the road, she has hit rock bottom. She goes to treatment, she goes to Santa Maria, and then they automatically start in the recovery, right? And they say, hey, what's something to keep you occupied? She said, drawing. Okay, let's do that. The moment she grabbed her pencil, she had her withdrawal so bad, she couldn't. She would throw the pencil. And I spoke to her recovery coach. She's like, and it would hurt to see her, Andrea. She's like, she would try, and it's like she had tremors so bad. I come into the picture. She goes, Andrea, look, I can draw now. She's already been a year into her recovery. That's my accomplishment, that I'm able to draw again. Mind blown, I said, let's get rid of the word certificates. Let's just put accomplishments, because it is for them to define what their accomplishment is, not for us. So again, doing these studies is very, very awesome over on our end as professionals, because they open up my mind to a whole different world, seeing the world through their eyes. And not only that, but also, it just gives me more and more strive to get out there and do these type of classes. I have another family that she put on here, 211, got Medicaid. And I said, what are you doing? What are you doing? And she goes, Andrea, I was on hold for 2 hours with 211. Then the lady who picked up didn't even speak Spanish, so I had to hang up on her. I called back another hour and a half. Finally, I got the Medicaid application mailed to me. Hell yeah, it's an accomplishment, Andrea. I was like, okay, you write it down. You write it down. You know, So again, it is for them to decide what their accomplishments are, for them to write them in. And not only that, but to keep track of them. So if by any chance, and I've seen a tab here being used by professionals, saying, whenever your client has a bad day, hey, look at everything you've been able to do though. Look at everything let me remind you what you've done. Let's go to here. And then we end with our notes and additional information. This tab here can be used however you'd like. For our CPS families, we actually make it because we know how many documents those families are going to get, right? So we made this one into their CPS file, family courts file, because those families going through that system have a lot of paperwork that they're given. So we designated it for that right there. But again, it is your decision what you decide to do with the portfolio. We provide the foundation. You run with it as you see fit for your population, your families, your clients. Okay, that is the portfolio. Okay. 7 tabs. At the end of the day, everybody, these are all documents that we all know about. All we did is just put them together in a binder. That's all we did. Very simple. It's a very simple tool just to give them back that organizational skill, just to give them back that coordination, be able to advocate for themselves, record every little step that they're doing with an ending result of naturally empowering them. Care. So let me give you example number 1. And I want to see if y'all were listening to me. So we have a single mom with 2 children. Xavier is 4 months old. Alexander is 18 months old. For Xavier, it's difficult for her to keep track of medical issues, appointments, and medications. Her home life is a little bit chaotic, which adds to her struggles. From the family care portfolio, what areas do you feel would be important to her, would be beneficial to her? Going by what I've described. Appointments, most definitely. Ooh, I love that one. Love it. Medication list.
The kiddos,
There you go, most definitely.
Child care resources and needs for children.
Oh, child care, that's choosing a child care. There you go. Awesome, everybody. So this one family, and we've all sat there, and they're doing word vomits, right? They're just your safe zone, and they're da 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 da, right? So let's say you decide to implement the family care portfolio with a client. As they're doing word vomits, you can already think just the way you did right now. Okay, we're going to be using this tab. We're going to be using this tab, this tab, this tab. Hey, family, I got you. Now, second example, Carolina. 4 months pregnant with her first baby. She's married to Juan. They are both heavy opioid users. Both are very nervous because everybody else in their circle is also opioid users, and everybody in their circle has had their kids taken away. But Carolina and Juan said, no, we're not going to do that. We're going to get straight. Carolina and Juan use methamphetamines and opioids. Going by the family care portfolio, what areas would be beneficial to them?
The referral list.
Yes. There you go, the referral list.
Drug assessment.
Awesome. Anything else?
or prenatal appointments.
Yes, prenatal care appointments. Super awesome. Not only that, but in tab 1, yes, ma'am?
Well, I had a couple of ways.
Ooh.
Appreciate it. For one, making sure. I'm sorry. Some of it already was kind of said, but for one, making sure that she have a OBGYN that she's going to on a regular basis, that she's getting the prenatal care, that she at least is tracking her progress if they're trying to be drug free. So they're keeping that track of test results of negative for her and her husband, if both of them are users. And if they're surrounded by people that are using, that hypothetically if somebody is possible going to overdose, that you know what's the treatment for that, how to use it, and so forth.
You're my A-star right now. You even thought about some things that I didn't even think about. Yes, ma'am, I shall take you to my next presentation. Most definitely. Exactly. How they can, one thing that I love that you said, they can empower their own community by saying, hey, I heard about Narcan. I heard about Narcan. And hey, do we all know how to use it? Do we know how to access it? So most definitely. So that right there is the family care portfolio, how it came about, how we decided to do it here in Texas. Again, some states, it's only provider driven. The client never sees it and it's still successful. In other states, it's client driven and it's only one page. We decided to take this take on it. And we did our studies and we did our PDSAs a lot of times and improved it, threw it back out, improved it, threw it back out, improved it, threw it back out. And how did we improve it? With feedback from families with lived experiences and from the correct professionals to provide feedback, leading professionals. So that being said, after this, you are completely trained to introduce the family care portfolio. So if by any chance you do feel it is something that you would like to start with a family, all you do is go ahead and order them, I mail them, you get started on them, right? So now I'm gonna talk about the implementation process. We have some organizations that do it, let's say one individual, 10 minutes. Let's say one individual, right? But sometimes for organizations, like for instance, Nurse Family Partnership, they had them all come into a meeting saying, where are we gonna store them? What patients are we gonna give them to? Everybody or just specific ones? And if specific ones, which ones? So they all got together and thought about this. Or I have other organizations that said, hey, everybody's just gonna get one that we feel needs one. Okay, what do I need from y'all? Right? Again, this is state funded, right? So we need to provide back the feedback saying X have been given, 500 have been given by X person to X families. So at the front of your family care portfolios, you're going to see a QR code, right? And all we're gonna ask for is very simple. The date, the initials, your initials, not even your full name, the name of your organization. Did you give it to them while they were pregnant, postpartum, or they already have a child over the age of 1? And why did you give it? That's it. You submit it, that's it. Now let's say I've had organizations that they order 50 or 20, and then they call me in a month later, hey Andre, I need 20 more. But they never did the attestations. Then I cannot provide them because they haven't, in order for me to confirm that you gave the first 25, I need for you to do this step for me so I can keep on giving them to you. So in order for me to keep on providing them, we do need this information here. Again, very simple, the date, initials, who you gave it to, and why you gave it to them. Okay, frequently asked questions. What if somebody lies on their form? Who does the family care portfolio belong to? Who are they lying to? Themselves. Easy peasy, right? Not only that, but also let's say if it's a document that you're gonna be using, right? As professionals, we're always gonna double check everything, right? They're gonna give us the guidance saying, okay, you're saying you did this? Okay, let me confirm it over on my end, right? They give you the guidance, you run with it. Is there an age restriction? Most definitely not. There is no age restriction. Can you make copies or scan them? With the client's permission only. Everything must stay original in the portfolio. If it does not, I have seen in family court that it has affected a family in a negative way. Mommy said, I've been to all my appointments. In tab 1, I have all my negative result, urinary drug analysis. Guess what? The doctor took it. Took it out. He kept it in, put it in her medical record, never gave it back. It could have been crucial in that appointment. We rescheduled her family court visit, went to go get the original back, and then we understood the importance of adding this question to our presentation. Do they have to complete everything? Most definitely not. Some of these sections are not going to apply to everybody. Even my families with substance use disorder, whom it is geared towards to, but again, it can go to anybody. Some of these things might not apply to all families. That's okay. We can take it as a learning opportunity because for some of these families, whenever they leave NA, let's say with the probation, when they leave something blank on a document with a probation officer, does that leave room for speculation? Yes. So why don't we teach them to place NA? Beat it before it gets there. Okay. So on your table, you actually have the documents where you're able to access your toolkit. Just the way the clients have a script, you have a script as well. You have a copy of everything that I've gone through today. This right here, this QR code right here at the bottom, you're able to request portfolios. You're able to take a look at the presentation again. You're able to do a lot of things. Look at the actual documents on here as well. Okay, and I'm going to end with this. So 200 families got our feedback and did our, right? So this is some of the feedback that we got from some of our families. Keep in mind it was called Plan of Safe Care first. This individual here, this family right here, she was one of the very first ones in the state of Texas to have a family care portfolio. She said, the Plan of Safe Care saved me. I had a previous CPS case with my 2-year-old, so I knew that they would be checking up on me. My caseworker was so impressed. Remember how I started this presentation, those families that have had involvement in the cases closed, but they still have that fear? This was her. Okay? It keeps me focused and organized. That I cannot stress enough on how many times I received it from all my women and families. It's like, Andrea, it just keeps me organized. Andrea, it keeps me organized. So I thought it was very important to add on here. It's very helpful in court. Remember that OB-GYN negative results? That's what she said. It's very helpful in court. Yeah, it is. Because she was able to provide all her negative test results. That, hey, I have been coming out negative in my substance, and all my urinary drug analysis. It helps me reach my goals. I felt that there was a team backing me up. Let me give you a little bit more on this one right here. There was nobody there with her, but all the providers had come together in her portfolio. Everybody had written in it. Everybody had partaked in her accomplishments, in her tab number 1. She's like, they're all in here, Andrea. So I felt it was very important for me to add that to our slide. Honestly, from my heart, it helps a lot. Lastly, ultimately, I got to leave with my baby, so it worked. The family care portfolio is not the reason she got to leave with her baby. The family care portfolio is only a tool. She is the reason she got to leave with her baby. She did the work. She did everything that needed to be done. All we did was provide a place for her to keep track and organize, for her to coordinate, advocate for herself, record everything that she's doing with an ending result of, yes, I feel empowered. Ladies and gentlemen, it was a pleasure presenting. Everybody has my contact information on your table. If you turn it around, there's also free CEUs for you to, there you go, right there. Let me borrow it.
You're fantastic, sir.
I appreciate that. Right here, I don't know.
Yes, okay.
I think at the end they're gonna send a little like, how did it go? It went amazing. She woke me up. So thank you very much, ma'am. I truly appreciate that. It was a pleasure being here today. I felt it was absolutely important because of the type of work that you do. My contact information is right here. I'm always a call, a text away, an email away.
All right, thank you so much. Yay, one more round of applause. Okay, a couple of housekeeping things as we close out our day. As we mentioned, to scan for your CEUs, you are going to see as you walk out a QR code on the door. Please take a quick picture of that, scan, and enter your responses. Remember, you're keeping up on your piece of paper about what you've attended, so feel free kind of in your next opportunities to mark off that you were here today. That will be a part of kind of the end. And then we are going on break, but be back for your next breakout session at 4 o'clock, our last one for today. Thanks for being here.
Awesome. Feel free to take the binders if anybody wants them off the tables.